Family Health Centers of San Diego. Can you tell me about your facilities?
Sure. We provide outpatient medical care to individuals all throughout San Diego County. Our clinics are located all over the place from Mission Beach in the north all the way down to Chula Vista and as far east as El Cajon. We have 23 clinics, and our main service is primary and specialty care on an outpatient basis.
Obviously, an unprecedented situation with a pandemic. Can you tell me how you've been affected at your facilities?
Absolutely, yeah. We wanted to start offering testing as soon as we could to really find out where we are and how many cases that we have, and have been able to ramp up testing to make it available to any of the patients that we see in clinic with symptoms, and then we've just recently expanded to those without symptoms, and we've diagnosed close to 250 patients with COVID. It's also profoundly affected the way that we are doing business because we've had to take increased infection control measures to make sure that it's safe for patients to be seen in person in our clinics.
Now, are your facilities to take all kinds of insurance, or people without insurance?
Sure. We are what's called a federally qualified health center, which is a designation that we have to see anybody that comes regardless of their ability to pay. And so our orientation is generally towards the underserved. We have a lot of patients that have Medi-Cal insurance. We have patients with private insurance, and we also see many people that don't have insurance as well.
A lot of impact, especially we've noticed in the South Bay. Can you talk about, how COVID-19 has affected, your medical clinics and your doctors and your treatments there?
Sure. I'd say going back about a week or two, the data that we were seeing from our own clinics, our own testing efforts, as well as this is reflected in the county's numbers as well, that there's really been kind of a new surge in the South Bay, in San Ysidro and Chula Vista, National City, Spring Valley. They've all seen really higher rates of testing. And one of the parameters that we use is the percentage of tests that we send that are positive. In many places in the South County, we're seeing 10, 15, even 25% of the tests that we're doing come back positive in these areas. And that's a real indication that the disease is undergoing widespread community transmission, especially in the South.
How are you faring for PPE and all kinds of medical equipment that we've seen other agencies struggle to find?
Yeah, really good question. We initially were worried that we were going to have shortages, but we've been able to have good enough stock through donations and through procuring our own PPE that all of our providers are protected. And we've been following very closely the national recommendations about what our providers should be using. And just recently, we've instituted a policy where really any patient or any provider in our clinics should be wearing at the minimum a mask to prevent asymptomatic spread. If a patient has symptoms and they're coughing and they're sick, then the provider will actually evaluate them in what's called full PPE with gloves and a gown and a mask and a face shield as well to make sure that everybody's protected. And as of now, like I said, close to 250 cases that we've diagnosed, and none of our providers or nurses have been infected using that strategy.
Oh, that's great news. And especially in the San Ysidro and in some of those areas there in the South Bay, you're dealing with, a lot of Hispanic families along the border. Has there, been an effort? Is there a message you'd like to get out to those Hispanic families that maybe it's not getting across due to, language barriers and that sort of thing?
Yeah, I mean, I have the luxury of having access to the county's briefings that happen every day. They're doing their best to push out information. And I just kind of wondered, as we're seeing these increasing numbers in the South Bay, whether the message is getting out. So actually later today, I'm going to be speaking to some other Spanish language outlets and trying to get the word out. It's a complicated issue. I think that people need to try to understand what's a brand new virus and a complicated thing and how to protect themselves. And I can just say that what we know as of right now is that there's a lot of silent transmission happening. So people that feel fine are probably infecting their family members and people around them. Some people see the beautiful sun come out and they want to go out to the beach, and they're just not really adhering to these stay-at-home orders, which is very hard after 6 weeks of doing it. And the more that we have more interaction, the more cases that we're going to see. And I'm just kind of worried that people are getting a little fatigued and maybe not getting the message. And another point I'd like to make is that, this is a disease, as do most infectious diseases, really highlight some of the social determinants of health and some of the inequities. We've seen in the numbers from the state of California that there is a definite health disparity, meaning that Latinos make up about 39% of the population and yet are more than 49% of the cases that we're seeing. And some of that might just have to do to factors that have nothing to do with language, say socioeconomic, for example. If you have a job where you're not able to telecommute and you still got to be in on the clock to do your job, then you're at much higher risk of becoming infected. And so I'm concerned that there's many factors that are really making this disease impact those in the South Bay, especially Latinos, disproportionately.
You know, I could tell you that tomorrow, I know the Chicano Federation is trying to get the word out also via press conference that Latinos, Hispanics are being greatly affected in the same kind of message. You know, from your doctors on the ground there who've seen patients every day, are they seeing that, and what kind of concerns are they sharing with you?
Yeah, they certainly are. We're just looking at our numbers of, like I said, the 250 cases that we have. I think over 200 of them are in people that speak Spanish and are Hispanic or Latino in their heritage. And that is traditionally the patient population that we serve as well. So we're certainly seeing people disproportionately affected. One of the other issues that's a little bit hard to get our hands around is what is the impact of being in a border region? We know that there are thousands of people that cross the border every day for work. And we've also heard some reports from the county health officials that the hospitals in Tijuana are a little bit more overwhelmed than our hospitals are. In fact, a couple of weeks ago, they reported on one of our clinical town hall meetings that there are 3 hospitals in Tijuana that are designated to receive COVID patients, and 2 of them had reached capacity, essentially. So that's really a desperate situation for people that really need to be taken care of. Many people get very ill with this disease and can't breathe. And so it may be the case that some are trying to cross for medical care across the border.
Is there any, you know, way to verify that? Are you seeing patients that are perhaps seeking better treatment here on this side of the border?
Yeah, I think we can say that there's a couple of anecdotes of situations that do reflect that. I'm aware of the county, you know, infectious diseases don't respect borders. That's the bottom line. And so our policy solutions and our public health solutions need to be very comprehensive, and we need to collaborate across the border. I treat a lot of TB patients. I'm an infectious disease doctor, and the county has a very nice relationship across the border to track TB patients that come and go. And as far as I know, I'll let the county speak for themselves, but I believe they're trying to do the same thing with COVID, because this is not a disease that's going to respect borders.
Excellent. And I mean, is there also a cultural barrier? Are they Hispanics and Latinos not taking this illness seriously enough?
Yeah, that's hard for me to answer. It's kind of my motivation to try to get the word out in Spanish. You know, I want to make sure that the message really comes out in Spanish as well. You know, Latinos have big families, and this is a disease that is transmitted from close contact. And so I think I personally, as a provider, have seen many cases where there's a house with 6 or 7 folks that live in a multi-generational family. And that is exactly the environment where this disease can spread relatively easily with close contact that way.
Let's do that before we wrap this up, but I do wanted to get back to the testing.
Mm-hmm.
Can you talk about the testing you're doing at your facilities? And is this the antibody test? Is this the nasal swab?
Yeah.
Touch on that a little bit more.
Yeah, so one of the things that we've known from the very beginning back in February when the first cases were seen is that we need to be doing a lot of testing to know where we are. Without testing, we're really flying blind, and our public health officials don't know where the cases are. And so testing has been absolutely essential from the beginning. What we've been able to offer since the beginning of March is the nasal swab testing. This is looking for actual pieces of the virus particle, the genetic material of the virus. And so it's only going to be positive in a short window. We think that that test will be positive from about 2 to 3 days before the onset of symptoms to about 5 to 7 days afterwards. So people that have symptoms have that limited window to come in and get that test. So that's what we're offering at our clinics, as well as some pop-up sites and parking lots, especially focused on the South Bay, for people to come in. Now there's a question of, well, should you test people that don't have symptoms? And what we've learned more and more is that many people without symptoms can still harbor the virus. So a good proportion, we're not exactly sure how many, but maybe up to 30 or even 40% of cases will not have symptoms. And so widening the net, so to speak, and testing more people without symptoms is probably going to be necessary to really define the extent of that. So we're actually testing symptomatic and asymptomatic people who would like a test, and it's the nasal swab. Now, the antibody test you asked about is a very different kind of test. This is not going to be useful to diagnose somebody who's acutely ill, because that test doesn't tend to turn positive until 2 to 3 weeks after the person's been sick. It's going to be interesting down the road to check for antibodies, and that's going to be a blood draw, like a blood test. So you can't really just walk up and do that in a parking lot. But it will be interesting to see, well, you know, I got really sick in February and the testing wasn't available. Was it COVID? I don't really know. That test is becoming more and more available. There are some technical issues that make it a little bit complicated because some of the tests on the market were not very accurate, and doctors and providers wouldn't know how to interpret them because of the sensitivity not being very good. But these days, moving forward, the tests that I think most providers are choosing are very good. And so going forward, we are going to be offering antibody testing probably starting in the middle of May.
Will everybody be accepted at your facility? If you're an undocumented person, can you get treatment at your facility?
Absolutely. It's really our mission to provide medical care to anybody, regardless of the ability to pay. So insurance, uninsured, private insurance, it doesn't matter. We can see everyone.
That's really great news. And just your own insights again on the South Bay, that these numbers, any thought that, you know, why we're seeing these numbers so high there?
Yeah, I think it's a complicated issue. I worry that it may be because of a lack of information in Spanish, which again, I'm doing my best to try to remediate that situation. I also believe pretty strongly that most infectious diseases will hit those that are the most vulnerable the hardest. And so those that have socioeconomic struggles, those who are forced to work in conditions where they're not able to telework or telecommute, they may be affected even more. And then there's that sort of X factor of what being a border town may be affecting us in a situation in Tijuana, which may be a little bit more dire than it is here in San Diego.
And that's why it's great to hear from you. I mean, we've heard from Scripps and the bigger facilities like Sharp and Palomar. So it's great to hear from doctors that are in some of these smaller communities that need more help, and they don't have, you know, all the insurance and financial abilities that a lot of other facilities, you know, cater to.
Yeah, I also have an appointment at Scripps, and so I get some of their daily case counts and that kind of thing, as well as those from Sharp. And both those two entities have hospitals in Chula Vista, and those hospitals are the busiest in the county, I have to say, in terms of COVID rates. It's been pretty remarkable. The numbers from our clinics, the numbers from the county, the numbers from Scripps and Sharp Chula Vista are all very consistent, and they're all showing this surge in the South Bay.
Great. And before we go, if you would, please, in Spanish, get word out to the viewers you're trying to reach.
Ya, quiero que todos los hispanohablantes que están allá, que reciben este mensaje, que este coronavirus es un virus muy grave que puede causar infección, puede causar mortalidad en personas, y las direcciones que nos da el condado de que no toca su cara, que si tiene síntomas, que no va a trabajo, y si observa distanciamiento físico, distanciamiento social, para evitar transmisión de este virus es muy, muy importante. Y si tiene síntomas o está enfermo, necesita ir a su doctor.